Well, good evening, everyone. I want to thank everyone for being on the line. My name is Dr. Ansel Johnson. I am the founder of Healthy Living with a Vision Foundation, and our mission is to eliminate healthcare disparities in communities of color. And it is, first of all, I'll tell you a little bit about our foundation. It was founded on June 19th, 2020. And as our mission, we are really out here to inform and empower communities of color to eliminate healthcare disparities. We have a lot of different projects, which I'll get into before a little bit later, but at this time, this is one of my favorites, which is our Low Vision Virtual Symposium. And we do these about 3 to 4 times a year. And our theme for today is helping the visually impaired child to live their best life. Now, as an optometrist, I have to confess, I was an under-referrer for low vision services. So I've been redeemed, but this is something that I'm really, truly glad that I have just kind of turned my wicked non-referring ways around. But this is an area which so many of us that are in primary eye care kind of, ignore and not ignore, but I think it's not top of mind when we see someone that we cannot help with vision impairment, that's all we can do with conventional glasses or a +3 magnifier, +350 magnifier. We are, under refers. And so I have the blessed affiliation with my classmate, Susan Primo from NECO, who specializes in the low vision, and I'll introduce her a little bit later. So our mission, again, is a 501c3 not-for-profit Healthy Living with a Vision Foundation. We do these, all my guests are volunteers, but I will solicit everyone to donate so we can keep this and many other programs up. Our website is healthylivingwithavision.org, and we'd encourage you to any type of donation you can. Just click our donation button on our website. We'll take anything, but we really appreciate your support. Other things that we've done, I do want to mention that we were actually one of the first organizations during the pandemic to have virtual meetings in January, I believe, of 2020 on COVID. That was before the vaccine, before there was adequate testing. We've done seminars on nutrition. We've done seminars on organ donation and donations in communities of color. One of our board members actually is a kidney transplant recipient that lives with lupus. We've done seminars on lupus. So we're really about educating and empowering the community in things that a lot of us don't even think about. So I'm going to circle back to our low vision seminar at this point. And so again, I'd encourage donations we can continue this great work. We've actually just recently done some in-person seminars on health and nutrition. I have 2 other physicians on our board of directors, but since I'm the president, I get to highlight the vision stuff. So I want to thank everyone that's in attendance right now. And I want to introduce, first of all, our guest, Janet Lebrecht, who is a known national thought leader. And in August of 2013, she was confirmed by the United States Senate to serve as Commissioner of the Rehabilitation Services Service Administration within the United States Department of Education. And Ms. Lebrecht put into effect the most substantial national policy regulation changes to the vocational rehabilitation program in over 15 years. After a 28-year career with the Massachusetts Commission for the Blind, Ms. Lebrecht was appointed to serve as commissioner by the former governor, Duval Patrick, until her transition to Washington, D.C. in 2013. She has an honorary doctoral degree in optometry from the New England College of Optometry, where her innovative partnership has resulted in the establishment of a mobile eye care clinic for individuals with low vision conditions. And the Janet Lebrecht Center for Low Vision Services was named in her honor in recognition for her commitment and dedication to the field of blindness at the New England College of Optometry, which is my alma mater. Dr. Susan Primo as I mentioned, is my classmate from NECO, is a professor of ophthalmology at Emory University, Department of Ophthalmology. She's director of optometry and low vision services at the Emory Eye Center. And she also received her Doctor of Optometry degree from the New England College of Optometry. And she believes that strategic public health approaches to address visual impairment and loss are desperately needed. And she received her MPH, Master's in Public Health degree in 2002 in the hopes of being in position to help combat this problem. She specializes in low vision rehabilitation, working with patients who unfortunately become visually impaired. She has lectured and published extensively in this area and sits on numerous boards for the blind and visually impaired. Now, Dr. Primo has been actively involved in vision rehabilitation, research, including low vision outcome studies, in collaboration with the Johns Hopkins University, age-related macular degeneration and cortical reorganization in collaboration with Georgia Tech, and the implantable miniature telescope clinical trials. Now, Tracy Williams is our next guest. He is the director of Spectrios Institute for Low Vision here in Illinois. He has served on the AOA Vision Rehabilitation as a council member. And Dr. R. Tracy Williams has an extensive background, but I'll let him tell you anything else that I'm missing. But this show actually features his organization, and we have a special guest from Spectrios that we're going to introduce. Let her introduce herself a little bit later. And again, the theme is about with pediatrics and their resources and things, because a lot of times parents just don't know what's out there. So what we're going to do now, because we have an action-packed show, is I'm going to come back to Dr. Primo to tell us a little bit about her programs and what they do for youngsters at Emory. And then we're going to go to Janet Lebrecht, who actually has lived and walked this path throughout her life. And then we're going to introduce our special guest, Jean Deptola. Okay, Dr. Primo?
Sure. Well, thank you for having me again on this program. It's good to be here and to give information, impart information to people. I've been, we won't say what year Ansel and I finished optometry school. Let's just say it's a couple of decades ago. So we've been around a while. So I've been doing this a long time. As he said, I also do some public health work as well. But as a matter of fact, I am heading to Tanzania on Wednesday for 2 weeks to work with children who have albinism. And so I do have special interest in that group. Albinism, unfortunately, is stigmatized in Africa. And so it has a very high prevalence. So I'm going to work with that. At Emory, though, fortunately in Atlanta, we have a couple of great organizations. One is called Center for Visually Impaired. And there's another one in North Georgia, Vision Rehab Services. And in particular, Center for Visually Impaired, CVI, has some wonderful programs for really infant through elementary school. The older kids tend to veer off doing something else, but one is called Begin that really works with parents and their babies, basically, birth through 3 years of age, with getting resources, having a support network, helping being advocacy for their kids. And then for the older kids, usually at around age 3 or 4, there's a STARS program, which has summer camps and things like that. So fortunately, I'm in a city that has a very robust network for children who are visually impaired. At Emory, I tend to see a little bit older children just because we have CVI here and I can refer them there. So I work with middle school predominantly, and then high school kids, and certainly college. But in particular, the driving issue always tends to come up. Parents want to know will their child or their teenager will ever be able to drive. And the short answer is possibly, but there are some parameters around state laws and things like that. There are many states that now allow what's called a bioptic telescope, which is basically a telescope that's spectacally mounted in the spectacles to be able to drive. It sounds a little bit crazy, but in reality, I did a study several years ago with a master's in medical science student that looked at accident and fatality rates, not in children, but in adults, driving with a bioptic telescope, but actually the accident and fatality rate was much lower in bioptic drivers. They tend to be more safe drivers. They tend to obey the laws. They don't take a license with hazardous conditions and changing lanes and all those things that we think about that we do as normally sighted drivers. So it's very important that parents understand that there is a possibility that their teenager will be able to drive, because as we all know, driving is a really big source of independence, and kids and adults want to be as independent as possible. So again, I'll just briefly say there are some parameters around it. As I said, there are state laws and requirements. Each state is a little bit different. Unfortunately, the vision guidelines for driving in general, there's no federal policy. It's all by state. So you have to go state by state to figure out if the child will be able to drive, the teenager will be able to drive. But just know that is certainly a possibility.
Thank you, Dr. Primo. Actually, that was a question I was going to have, because this is actually a national forum. So since I'm in Boston for this meeting, this is actually NECO heavy, but we have invited a number of low vision directors and clinicians from some of the various schools to be online here. So it's good that you point out it's a state by state thing. And maybe, you know, what I always think about at a higher level is national policy. And maybe, you know, if you think it's an idea to come to talk to our state legislators and about maybe a national policy concerning driving and bioptics and things of that nature. And, you know, with that being said, I really want to steer this to Janet Lebrecht, because she has served on a national level as a commissioner. And just to talk a little bit about her experiences from peds to adulthood in this process, and then we'll invite our special guests in terms of as we go forward.
Thank you, Ansel, and thank you for inviting me back here again. Also, I am always excited to hear about discussions like this, and definitely interested in hearing from people who are listening to this program this evening, because it's such a critical topic area. And from my perspective as a former commissioner for a blindness-specific agency, but then also at the national level, I think that it's always critical and important to emphasize the types of services and supports that are out there. I am legally blind myself and have lost pretty much most of my vision at this point from retinitis pigmentosa. And so I started losing my own vision as a child and recognized that, you know, the isolation that kids go through, the experience for parents, specifically when they're trying to navigate our systems, it's very challenging, to say the least, in terms of, do I have the right agency? Do I have the right representative that's working with the family and working with the child, working with the school systems? And so all those types of services and supports that are available to youth and certainly infant programs as well are really, really important to make sure that the team is there, that is available to the family and available to the child, available in the classroom, to make sure that they have those supports there. And, you know, fortunately for us here in the United States, we have a very comprehensive system when compared to other countries, but it's still challenging, and it still needs, you know, some additional focus areas and working with those individuals that are from underserved and underrepresented communities here in the United States. But also our laws and regulations and rules and regulations, you know, are, I think, at a point in time now where, you know, during the time when I was promulgating legislation as well as rules and regulations, that we have really tried to expand and focus specifically on youth, in helping youth to really prepare earlier in life. And that, from my perspective, the earlier, the better. And so getting to youth, getting to parents, having those discussions, introducing those services. And then I think also important is the vocational rehabilitation system itself, since in our country, families and individuals have access to the vocational rehabilitation programs, and especially for their kids, these agencies and programs have services and supports that are available. So it's really important to get that information out there and make sure that families have access to it and that they are taking advantage of it And then the educational systems as well. It's really important to have those connections to the school systems and certainly the supports and mentoring, strategies and access to mentors and helping youth, as they're navigating their way through, challenging diagnoses and certainly looking at their own prospects for education and employment, that it really does call for a network, if you will, and conversations at a national level to continue the dialogue, but also to continue to expand on the issues.
No, thank you very much. And again, we're about disseminating information. And what's really special about this program, again, we are reaching out, and I want to recognize Paris Wright, who is on the line, and she's been a presenter before with us, who is from Midwestern Chicago College of Optometry. But I think it's going to take a lot of collaboration amongst the schools of optometry to talk to our legislators, just like we're talking about expanding scope of practice for optometry, that we really need to look at making sure that people are aware of these resources for visual impairment. Yes, it's a little different between states, but we really have to look at that. And that's why I'm really happy to feature Dr. Tracy Williams' organization, Spectrios, and what they're doing, some phenomenal work in the state of Illinois and in the Midwest. And hopefully I'm really about collaboration and sharing of information. And I think we need to do that more. We all get in our little tunnels here. So I'm going to introduce our special guest, Jean Deptola, who works for Spectrios. Her resume is so long. I'm going to let you read it because I don't want to miss a beat. But I want you to tell us a little bit about yourself, but also tell us about the work that you're doing. And, everybody might be doing the same thing at the same level. I don't know. But if there's something someone else can add, be sure to do that. And at the end of this, hopefully we'll finish a little before 7:30 Central, 8:30 Eastern time. And I want a representative from the schools that are on the line, if they can tell us a little bit about their low vision programs. So I'm going to leave some time for those other institutions to speak a little bit about what they do. So you will not get left out. But Jean, I'm going to let you take it away, young lady.
Well, if I could just butt in for a second, Dr.
Oh, I'm sorry. That's I was supposed to come back to you.
If I could butt in for just a second. This is
Not a problem.
Tracy Williams, and I have had the pleasure of working with Jean. She is just an unbelievable professional that has been in the educational system, and she makes such a difference, such an impact with students K through 12th grade. And I only wish, Dr. Ansel, that she worked for Spectrios. In fact, after you said that, I said, I wonder if I could hire her. But she actually is in the educational system. But what you did say, Dr. Ansel, about collaboration, I am so proud to be an accredited multidisciplinary vision rehabilitation center that is so lucky to work with vision itinerant teachers, educators, and boy, I just think, Jean, that it's just a wonderful thing because we really help the students and their families really be able to navigate through the educational system, but almost with that spirit of like the little locomotive that said, I think I can. So here's the queen of little locomotives, Jean. So Jean, you take over. I wish you were working for me, Jean, though, I tell you.
Well, I retire in a couple of years, Tracy, so I'll give you a ring. So,
Are you there?
I am at my heart, I am a teacher of the visually impaired. So I have worked in the school systems with children who are visually impaired since 1986. I am a Illinois licensed teacher of the visually impaired. I have a master's degree in orientation and mobility, and I have a supervisory endorsement. I also work as a deafblind specialist for our state deafblind program. The organization I work for, Northwestern Illinois Association, we provide services to over 70 school districts in the 10 Northwest counties of Illinois. We are a low incidence regional program, so we provide services for children who are visually impaired, hearing impaired, physically disabled, multiply disabled. Our communities are anything from large urban communities such as Rockford, Illinois and Elgin, Illinois, to very, very rural communities way out in the west side near the Mississippi River. Currently, I supervise, we have a team of about 18 teachers of the visually impaired that work directly with children in the school districts. We also work with early intervention programs for the birth to 3. So I'll talk a little bit about how things look in Illinois. We are all, just if you talk about the national level, we are all working under the same special education national law, the Individuals with Disabilities Education Act, and that covers all of our states. It looks a little different from state to state. In the state of Illinois, we have programs statewide for children who are birth to 3. So if we're talking about connections, like I am very excited that we have a lot of medical professionals here because you see our kids sometimes first. And we would love to have partnerships and collaborations so that you know where you can send your families. I said earlier, there's no guidebook like a Dr. Spock book or what to expect the first year for how to raise a visually impaired child. So we have at the birth to 3 level, the state is divided up into offices regionally called Child and Family Connections. So some of our larger university-based programs like Lurie's in Chicago, Rockford Memorial, will connect our families at a very young age with Child and Family Connections in their area. And they get a service coordinator whose job it is to look at each child and identify those specialists who will do an evaluation so the child will get services. So if a child is visually impaired, we have individuals in our state who are licensed teachers of the visually impaired and also have an emphasis, additional training in working with infants and toddlers, and something I used to do for a period of time, and do evaluations and determine what kinds of supports and services are required. And those services are provided in the home. At that level, the documentation, it's called an individual family service plan. So services provided in the home because that is the natural environment. They work on developmental vision skills, specialized towards that child's developmental level, their level of vision loss. We put a lot of stock, just so that you all know, in the information that is provided from the medical field to us. If I have a child who has retinopathy of prematurity, if I have a child who has optic nerve hypoplasia, I like to have acuity measures. I like to know if they're sensitive to light. We take all of that information and we look at function. So we work with parents on how do you play with your child if you're not making good eye contact? What toys do you want to have in your house? How does your child know who's who when grandma comes to visit? When you want to get your little one up and walking around and they can't see the floor because it's too far away, how do we help them develop motor skills and speech and language skills? So all those services are provided in the home, and about 6 months before that child turns 3, the Child and Family Connection Service Coordinator makes a connection with the local school district, and that's where we take over there. At about that time, the school district works with the family, and again, does evaluations and looks at what educationally relevant services are needed. So we start to look at preschool settings for those kids that turn 3 if they've already been in the system. We get a lot of kids that come into the school system who have not yet been identified in any sort of formal way in terms of services with a vision loss, which is a little heartbreaking when they come to me a little bit older, because I like to get them as young as we possibly can and provide the supports as early as possible. But there is a function in school districts in the state of Illinois that anybody who has a concern about a child's ability to use their vision in school is able to refer that child again for services, and those services are governed under the Individual Disabilities Education Act, IDEA. And so there are rules and regulations, and we have to get parental consent, and we solicit medical records, and we do evaluations. And when those children are eligible for vision services, that's when the fun starts. That's when we get to educate our children.
So Jean, let me interrupt real quick. So basically, those of us that are in eye care, optometrists, if we happen to see a real young child can we initiate that with the school, or you get these referrals, right? So we
We
can
do.
actually contact the local school with the parent and say, and
Yeah,
verify
I would-
this child is something that needs a little above and beyond care.
I would
routine.
absolutely recommend that if you have a family that has a child that has a visual impairment, if they've not yet been connected to their school district to receive services, that's something that's extremely important. If they're under the age of 3, then I would actually, you can contact your State Board of Education and they can give you information on the structure of birth to 3 services in your individual state so that you know where to make the referral. Once those children turn 3, they are eligible for services. Once the evaluation is completed, the responsibility lies in their home school district. And so, and the information that comes to us from the doctor is huge. In order to be eligible for services, we have to have some sort of evidence that there's a visual impairment. And sometimes we have to chase that information down. It's not always easy to find. And honestly, in some of our underserved communities, that's a tough piece. We have families who are putting food on the table, families who don't have a local doctor that takes, Medicaid, or families that don't have insurance that covers eye care. So that's where, we have resources. We have visiting nurses associations, for example, that work in Elgin and Aurora. So we can get the kids in, and we have eye doctors that will come to the VNAs, and the nurses in the school districts can help kids get eye care. In our area, we also work with, we started this with the Illinois College of Optometry a number of years ago in the Department of Public Health, but we call them difficult to test vision clinics. We have a lot of kids that are, our visually impaired kids are on the gamut. We have kids, I've had visually impaired kids that are in calculus. And so my job was just to make calculus big enough for them to see it. And we have children that have severe disabilities, and our kids with vision impairments that have significant disabilities, we're talking about living their best life. Those kids are every bit as entitled to get eye care as any other child in our state. And so we do have a couple of doctors that we work with to provide eye care for, and eye exams for some of our kids that are on the autism spectrum, our kids that are in wheelchairs and that are nonverbal. And so we have a couple of doctors that have the tools where we can, I don't know if this child is not communicating because he can't see the pictures you're giving him, or whether or not he doesn't understand it. And if we don't, you discover a child with Down syndrome that has, a -8 prescription, then I have to wonder why they're not communicating if they just can't see what you're putting in front of them. So that's another resource in addition to Tracy's program where we can provide services. But we do need the doctors to connect with us in the schools so that we can identify kids.
Right. Yeah, I really appreciate that. And I'm so happy because I have to give him a shout out. Dr. Howard Purcell, who's the president of NECO, is on the line. And as I mentioned, it's been a while since I've been in optometry school, but maybe we should really look at least giving our optometry students, those that are not specialized or engaged in low vision, to let them know that these are sort of things that we're going to see out in the real world, and that we need to be another advocate, as opposed to just saying, well, there's nothing I can do and send a parent to the school. But maybe if it's just giving people a list they can keep in their office of maybe the state resources that maybe they can direct the parents to, or make a call or a form that we can give to be an advocate for our patients.
Absolutely. I mean, there are vision services available in the school system for all kids in all states. And it looks a little different in everybody's state, although we all operate under the same law. It's implemented a little bit differently. But we, the things that we work on with our kids, we work on utilizing their vision and teaching them how to use those low vision tools, both the low tech and the high tech. In Illinois, we now have a master's program where our vision teachers can go back and get an additional master's degree in assistive technology specific for children with vision impairments, because technology, before COVID, but now with COVID, sometimes it's as simple as they need a larger screen than your standard Chromebook. Simple things like that. But they have orientation and mobility specialists, and one of the things that I really want to emphasize, because this is about your children living their best life, is we have parents that just can't envision what their children are going to be like as adults. And we work very hard, very early on, to work with our kids so that they don't identify themselves as just by their vision impairment. We have programs where we get families together. We have kids that have never seen another visually impaired child, that, you know, teenage boys that don't talk to their teachers, but you give them a couple other kids who can't see really well and they are chatting away. And the least important thing about that friendship is that they're visually impaired. Like, yeah, we're all visually impaired. We don't really care. They want to know what kind of music they listen to. And so we really focus very hard on including children in programming, including families in programming, opening up opportunities and getting the message to our kids that, you know, you own your life, and you are just as entitled to share your dreams and your interests and your goals. And it's our job as educators to give you the tools and resources to meet those goals, whether it's, you know, I want a job out of high school, or I want to be a lawyer, or anything in between.
That's fantastic. And that brings me to the second thought, because I'm going to come back, since you don't work for Dr. Williams. But I want him, and he mentioned this briefly to me before offline, but Spectrios has a summer camp for kids with vision loss. So Dr. Williams, can you talk about that a little bit? Because when you talk about kids coming together with similar, you know, vision impairments, that just, you know, brought up the light bulb in my brain. And if you could talk about your summer program, and there might be others similar to it, but again, you all are doing phenomenal work.
I would love to. First of all, I'm at the Spectrios Institute at the Dike House of Hope. We're in Wheaton, Illinois. We've been there 36 years. We've seen over 40,000 patients, all age groups. We have a comprehensive, accredited, multidisciplinary vision rehabilitation approach. Some of the things that we do is we have 3 programs going on. The first one is we have what we call Grandma Martiel Summer Day Camp. And Grandma Martiel Reinsdorf, the late great grandma, was the wife of Jerry Reinsdorf, the owner of the Chicago White Sox and Chicago Bulls. And I'm sorry I've got a cap and outfit on here, but I finished White Sox examinations today. Oh, was this a rough season? But at any rate, next year will be better. But the Reinsdorfs helped to fund us. And we've had a summer camp in July for a week, grade sixth grade to 11th grade, for students with vision loss. And you know, it runs from 9 in the morning till 3:30, and it's an in-person arrangement. We've been able to do that. And we, you know what, we have fun. We go to an arboretum, cooking classes, White Sox Stadium tour. We go to the zoo. We do all those types of things. But we also have half of our day structured for access technology and just talking with the students and socialization. And I think that when students have the opportunity to meet other students that have vision loss, that is a real positive. And if you have some of your camp counselors, so to speak, who have vision loss, who are employed and, you know, are just those people that have that attitude that my vision loss will never define who I am. My head and heart will. So that's the first one, but we got a second one.
Tracy, can I just share something with you?
In.
One of your old camp counselors, who was one of our students,
Yeah.
Haley from Batavia.
Yeah.
He was a young visually impaired student. She came to us as a student in 2nd grade. She was a counselor in one of Tracy's programs. She is now a licensed vision teacher and works for me full time with visually impaired kids.
Yeah, sometimes these seeds that we plant, and sometimes when these students are young, I think the low vision team, what they do is not just clinical things, but the psychosocial. And I think that just like when I was playing Little League, if you have a coach that tells you, that you can hit the ball instead of don't strike out. I just think that those powerful messages at a young age, and plus if you have the opportunity to surround yourself with people that have climbed the mountain, that have vision loss, it's just great. And we all know that access technology is such a game changer right now that can help these kids be competitive in the classroom. But let me talk about our transition conference, and that's in June. And this is like a week of fun, learning and connecting you as you prepare for your next adventure, which is transitioning from high school to what your career goals are. And you learn how to get services and support after high school. Can I learn how to drive? That was what Dr. Susan Primo was talking about. Coping with emotional and social issues, navigating at college and at a job, and even virtual cooking and different activities of daily living. Like we all go to college and we got to do our own wash, and we have to learn to live alone. So I think this has been a very good idea, could be implemented anywhere where you have a transition sort of conference where you can talk and help both this graduating student, but the parents plan for success as they move on to their career. But the last one I'll just throw out is we're starting a parent support group, because again, it's what Jean was saying, that when you have a child with a vision loss, and as you're raising them, you don't always have the father knows best manual on that. And I think when parents can talk to other parents, and sometimes their children, their students have similar diagnoses, and they're confronted with similar social issues. And here's a chance for people to make connections with other parents, maybe gain the tools and strategies to be able to advocate for your child, and just maybe beginning to feel that you're supported and empowered, and that you can really help see the potential in your child. One of the things I think of as a low vision practitioner is being able to see potential sometimes in people with vision loss, honestly, when nobody else can. And those powerful words, as you find what they can do, and you start to tell them that they can do. And so a teacher like Jean, I mean, she's there 24/7. And so I think you have to work on the head, heart, and eyes. And right, Jean?
Yeah, I was going to say, I think Tracy has hit a really important piece in terms of getting families together. In the past year, last spring, I had some amazing teachers. We decided we were going to just try post-COVID to have a little get together for families. In my small little office area, we thought we'd have a few families and a couple of activities for kids and order some pizza. We had 82 people register. We had to move to the Kane County Fairgrounds to have enough room. And we hit a nerve. And we had two families that had daughters. They each had a daughter with a fairly rare diagnosis. They had no idea there was another family in the area. Those mothers hooked up. We had parents that had older children who were sharing their stories with parents of younger children. We were lucky enough to have a Spanish language interpreter. So we were able to include a larger group of folks to make those connections. And when we did a feedback survey afterwards, they want more. And so this year, we actually have coming up in October, we're going to go to the pumpkin farm. We got about 14 families that have registered for their young children to come. And we're going to have vision teachers and mobility instructors there for some guided activities. And then let them do their thing. And we were lucky enough to get some generous donations from our local Lions clubs to help supplement the cost. We're going to do bowling, I think, with the teenagers in the wintertime. And then we're going to follow up with another family parent event. So that, again, following up on just parents that the ability to talk to other parents, especially those that have young children who are really, and there were some tears, but I think it was great to see the parents of some of the older kids. I've been with them. You know, there's a parent of a high school kid, and I've known Thomas since he was 3. And to watch the path this family has gone through, and to see them in a position where they can mentor families of younger children in a way that, you know, I can't. I've raised 4 kids. All my kids they're not visually impaired. So, you know, I've done a lot of this, but I've not walked that path. So it's very, I think it's really important that we can connect those families together so they can encourage each other in a way that as professionals, you know, we do have a limit.
That's fantastic. And Jean, I think, again, I'm real big on collaboration, and these type of programs are so critical and important to give parents hope and really to get the word out. And that's kind of the purpose of this forum, even though it's kind of geared towards the public. Again, I'm so happy to have people at some of the various optometry programs on the line. And I want to, in our foundation, we want to be the source of funding too. So again, healthylivingwiththevision.org. Please just press the donor button and see what you can do. So we can help work with Jean and help work with Dr. Williams to, because we all know kids in the community that may need these services, but not know how to get their kids transportation-wise to these programs, or be able to afford some of the technologies that will be life-transforming for these children. And one other thing I want to bring out, you know, we all talk about diversity, equity, and inclusion. Spectrios really works in a broad-based community. And I want to give my hats off to you for working in communities that are often devoid of practitioners and resources in eye care, just of some of the optometry programs. One of the reasons NECO just had its 50th anniversary last night of its affiliation with community healthcare centers. And one of the reasons I went to NECO is because of the diverse patient population that I would see as a student. So I'm still going to give a chance for some of the students, anybody from the schools, to talk a little bit, but I want to kind of wrap things up a little bit with Jean to see if there's anything else you'd like to, any other topic you'd like to talk about, because we try to keep it at about an hour for the presentation. Sure. And then also come back to Jenna Lebrecht too, because again, she has lived through this. Her whole life is a testimony, and I call her like a super advocate. And so she's my secret weapon to really have some insight on the federal side in terms of trying to get some policy changes. So Jean, I'll lead off with you.
Yeah,
and
actually, I'd like to address a little bit, and maybe this will transition nicely into Jen, a little bit about, we talked about what we do with kids when they're little, but what do we do with them when they're going to graduate? Mm-hmm. So we do work hand in hand with this Illinois State Department of Rehabilitation Services and the Bureau of Blind Services. And we work very hard to have them a collaborative part of the education process. In Illinois, we start when kids are 14 and a half. And what we really, at that point in time, their part of their educational program has to focus, it has to include a transition plan. A number of years ago, we found we had kids that were in 11th or 12th grade, and suddenly you're backpedaling. You know, we are able to provide a lot of equipment and a lot of supports in the school program free of charge to kids. But when kids need to go to school and they have to give their devices back, you know, how do we prepare them? So we work really hard to get those families connected with rehabilitation counselors as early as possible, providing them with contact information and what waiting list you need to get onto. And if you need to get, you know, a free bus pass, or, you know, how do I get a job, but how do I get to my job? So we have to have those relationships in place early on, because those kids, I have students and in some of our underserved communities. And I just saw one the other day, and she is smart. She has albinism. She is feisty. And I said, you're going to graduate this year. What are you going to do? And she said, I don't know. And it breaks my heart because I know why she doesn't know, because we talked about it. She doesn't know what's available. She came to us, she's moved around a lot. So she came to us this year as a senior. So I told the vision team, I said, you got 7 months or so. This kid needs to know that she can do whatever she wants to do, that she could go to college. So I said, so it's all about her tools and resources. Get that family connected with the Department of Rehab Services. What I don't want is for our kids to feel like after they graduate from high school, it's just a black hole. The more adults with vision impairments we can get in their lives, the more connections to adult services we can help for those kids and those families, especially our families that are just working to put food on the table. You know, they want their kids to be successful. They want their kids to follow their dreams. And so we really, you know, try to help make those connections to services, you know, at the adult level once they're done with us. And, you know, when I can see my students later in life and they're happy and they're gainfully employed and they're doing the things that they dream to do, then I know that we've done our job.
Yeah, and like I said, we have a real life example here of someone that's performing at the very highest level in life. And so thank you, Jean. Again, you opened up my eyes and hopefully a lot of our listeners in terms of just looking at the possibilities and as we say in the title, you know, help children that are visually impaired live their best life and not put any restrictions or limitations on them. So Jen, I'm going to let people hear, you know, your life story briefly, and then we'll let any other representatives from any other optometry school programs on the line talk about what they're doing in the community.
Sure, thank you. And again, Jean, you know, thank you so much for sharing those stories, because, you know, that your client's story or your patient's story is not at all that different than my story and thousands of other young people who are living with blindness or visual impairment. In that, you know, the biggest challenge we have is really finding someone, even within the family unit, you know, to believe that this individual is certainly capable of choosing career paths, accomplishing goals and objectives that they, you know, identify for themselves, as long as they have that support system in place. And many times the concept of that support can oftentimes begin right in the optometrist office. My first visit to understanding and knowing that I had a condition began in an optometrist office. And that led to, you know, more in-depth and certainly specialized eye care to, you know, confirm the diagnosis. But most importantly, I was able to get that connection, you know, to other agencies, other support services that, you know, were available. You know, I come from a household where 4 out of 6 of us are actually blind. And, you know, it was very, very difficult for my parents, as you can imagine, to navigate not just one of us, but 4 of us out of 6 kids, you know, that were losing their vision. So finding those support systems and taking advantage of it. Sometimes family members, particularly you'll see in the African-American community, sometimes where it's hard for our community to sometimes accept that outside support services. What works best is that when they see others and when they can share their stories and when they can see others who look like them, who come to their home, who provide services, as so that they can in fact, you know, feel as though they have that trust and build that rapport, you know, with practitioners or teachers. And so it's really critical as early as possible, as Jean talked about as well, is helping to connect, getting those mentors, peer counselors, getting support for family members. The parents oftentimes are extremely challenged and can get very frustrated because they're trying to navigate, in many cases, multiple systems You know, we need in this country to have a system that is not just reliant on sending referrals from one place to another, but there is a connection to help make the process as seamless as possible for students, for individuals when they're in the school system, to vocational rehabilitation services, other support services that may be available to the family or to the student, you know, from private nonprofit organizations. We really need to support that kind of a concept because it has a direct impact on these individuals. And if they fall between the cracks, everybody talks about the cliff effect, which happens after high school. They drop off and they're no longer in the entitlement phase of their lives where they're entitled to specific services, and then they move to eligibility, you know, parts of the systems where they then have to meet eligibility depending on the agency or program that they're seeking services. But I think a lot of it, again, starts back at the medical community as well and with the family. First of all, to understand the diagnosis. Secondly, that the practitioner, the clinician leaves the individual with hope, and that letting the families know, yes, it's a devastating diagnosis, but it is not the end, you know, of this person's world. There are services and supports, and having that process by which that everyone is working to keep these individuals connected as early as possible to whatever system it is that they're navigating, because that's what makes the difference. It's providing that hope. It's providing the information that there is something else out here. You're not alone in this process. And I think that really, really makes a difference. I know it made a difference for me. And so when we're in our own communities, providing that information and the referrals and services and encouraging people to work together, partner together, and not just think about, well, you can't come here because you're not eligible, but you can go over here. And that's, you know, that kind of a process for families and individuals with blindness or visual impairment is really frustrating.
Yeah, okay. No, thank you so very, very much. Like I said, Janice, you're inspirational to me and so many people. So thank you, thank you, thank you. So at this point, we're got about 7 minutes, but I want to also acknowledge one of our not-for-profit committee members, Diane Powell, who's actually a former CEO of one of our local hospitals. So I was able to drag her, and thank you for listening in. I also want to give acknowledgement to my
It was my pleasure.
classmate.
Thank you.
Thank you, Diane. I also want to give shout out to my own classmate, my other classmate on the line, Joanne Caruso, Dr. Caruso. So I didn't know if you want to speak on behalf of the New England College of Optometry, or I should leave that up to Dr. Purcell, the CEO, president.
Thank you, Ansel. Well, I'm not sure, I'm sure Howard will want to say a few things too. I know at our school, you know, we have our low vision clinics in, for example, the Perkins School for the Blind in Watertown and the Carroll School. And so our faculty and our students and the low vision residents go there and work in those communities. But I'm sure Howard will have a few more things to say. And yes, there's 3 classmates on the line.
We're still pushing, we're still pushing. All right, Dr. Purcell.
Hi, everybody. I was not prepared to make necessarily any comments, but you know me, I'm always ready to. First of all, Dr. Johnson, great job. I'm so happy I had a chance to sit in and listen, and some of my favorite people on this call. So very quickly, I'll just say, you talked about Janet Lebrecht as your secret weapon. She's been our secret weapon too. So we're going to fight you on that one. Janet's been an amazing asset to our institution and supporting our board. She's my boss too, so I have to be really nice to her, but she's done an amazing job really. And we wouldn't be where we are without. I think Dr. Caruso mentioned Perkins and the Carroll School, and I know it's near and dear to Janet's heart as well, those places. And she's also served as our commissioner. We have the wonderful opportunity to be affiliated with the Mass Commission for the Blind with a residency. So I know Dr. Caruso is aware of that. In addition to what she mentioned, we're really proud to partner with the Mass Commission for the Blind. By the way, Helen Keller was a commissioner, as was Janet Lebrecht for the Mass Commission for the Blind. Very special place. So that's wonderful. And we've had already 2 graduates from that program that are serving their communities. It's something we're really happy about. We do some work with the National Institute of Health in looking at telehealth for low vision. I listened to Jean. Jean, you are incredibly inspirational. I learned a ton from you. Wow. I thought I had a lot of energy until I listened to you. So wonderful job. Keep doing the great work that you're doing. It's really impressive. But I will say that, you know, we have a great faculty at the institution working on telehealth as an opportunity to reach people who we may not otherwise be able to reach. I mean, think about low vision devices as an example, kids or adults. If you can see them in their own environment and watch them using the devices, maybe not necessarily force them to come in and come to our offices all the time, certainly for initial assessments, but perhaps for the follow-ups. And so that's something we're looking at. And we have a great faculty, Dr. Ross, Dr. Malkin, Dr. Martin, all just doing a fabulous job. So really proud of that. And have to mention my colleague, Dr. Primo, who's just an amazing example of serving her community and someone we're particularly proud of. So I'd like to say something about everybody, but I don't know the rest of the group. Dr. Williams, obviously doing some great work also, but we're proud of what happens in NECO. Come and visit us when you're in Boston. And Dr. Johnson, it was amazing seeing you last night. Thank you for your support of our 50th anniversary. That's something we're particularly proud of as well.
Thank you so much. And I want to also give recognition to Dr. Paris Wright, who is again a national person on the level of low vision. And she's close to me also. She's been a guest on our panel. She just has some scheduling conflicts, but she is always top of mind when I think about low vision in the Chicago area. But she is a national speaker, and she's on faculty at Midwestern Chicago College of Optometry. So I want to give her a chance to chime in on the things that they're doing.
Well, thank you, Dr. Johnson. Thank you for having me. Yeah, the last couple I've had some scheduling conflicts. Sometimes being a mom and being an optometrist is like a real balancing act. And I'm mostly a chauffeur and pay for things, and that's what my kids think I do only. But but when I'm not doing that, I am being an optometrist and serving low vision patients at Midwestern University. As you say, I teach the low vision course there and am growing that low vision clinic. We're a new school, so our clinic is continually growing. So we are looking to obviously serve more low vision patients. Currently, we're looking to do more pediatric low vision. We don't currently do a ton of pediatric low vision. We do have a large pediatric clinic, but we don't do a lot of pediatric low vision. So most of our low vision patients are adults. And so we have a really nice living simulation lab there, which is really great for doing training and things like that. We have an occupational therapy program there, which is great to be able to kind of collaborate with. And we have a really good electrodiagnostic clinic there. So it's really nice when we need to be able to run that kind of thing, or if we've done genetic testing, or if you need a VEP or ERG or something like that. On the research side, I'm currently working on, have a small grant to work on a research project that is looking at generational attitudes towards vision loss to see if there's any differences between younger people who have vision loss versus kind of middle age or older people who have vision loss, in hopes that it will help us with providing people other services such as counseling and referring them out for services, and how we approach our low vision patients when they come into the clinic. So yeah, so if you see me at Academy, I have a couple of low vision lectures at Academy. So if you see me there, come by and say hi. Thank you, Dr. Johnson, for giving me the floor for a few minutes. Not a problem. In our next presentation, with your daughter's permission, we may actually try to get you on the panel again. Right. Now we have quite a few people online that I don't recognize. Is that if there's anyone else from another optometry school program, please chime in and let us know what you're doing. Okay. Well, if not, again, I have to really toot our own horns at Healthy Living with the Vision Foundation. We're going to be doing these at least 3 times a year. And my vision is to have an in-person low vision symposium where we cover all of these plus more topics face-to-face. And we're looking for sponsors
to be able to do that on a national scale. And that's what I'm so grateful about this forum that we've had. It is truly a national forum. And we can even grow this internationally because it's such a huge need. And people that are like Janet, living their best life, serving our country on a national level, national cabinet position is truly so inspirational. So we have a lot of talent that's out there that's untapped, and that we really need to tap into, to be encouraging, to allow our children to see and live their best life. So again, healthylivingwithavision.org. Please, please get on our website. We will be posting this video on our YouTube page, and if I can figure it out, our Facebook page. But we will be recording this, but we do need support. So hint, hint, schools of optometry, we'd love to have your support to really get the word out to all the programs, both the schools of optometry and the general public, especially underserved. So with that being said, we will end this seminar. It's been a blessing and a pleasure to do this one more time. Thank you, my classmate, Dr. Primo. Thank you, Janet Lebrecht. Thank you, R. Tracy Williams. Thank you, Jean Diptola. So you all have been
My pleasure.
phenomenal. I've just been so blessed. Every time I do this, I just get excited. I'm looking forward to the next one. You can look on our website and our Facebook page, and we will give you the date. It'll be sometime in February. Just got to figure it out so it doesn't conflict with the Super Bowl, okay? So you all take care. We generally do these on Fridays, same time, every time we run these. So thank everyone for participating, and you all be well, see well, be blessed. Healthylivingwithavision.org. Thank you, everyone.